All right, again, welcome. My name is Leanne Foster, and I am a Provider Outreach and Education Specialist here at WPS Government Health Administrators. And I'd like to once again welcome you to our webinar on provider enrollment for Federally Qualified Health Centers, or FQHCs. I do need to start with our disclaimer. So the material that I am presenting to you today is accurate as of today. As you know, if you spent any amount of time working with the Medicare program, Medicare changes often. So I will encourage you to please always make sure that you're reviewing official CMS communications, which includes both the CMS and the WPS GHA websites, just to make sure that you are up to date and staying up to date on the most current CMS rules and regulations. I will also be answering questions based on the current regulations today. And I do need to remind you that photographing, screenshotting, or recording of this education for profit-making purposes is prohibited by CMS. As you heard me mention just moments ago, I did start a recording of this session. So that means that we already have a recording for you. And barring any technical challenges with that recording, today's session will be made available to you on our WPS YouTube channel as an encore presentation. Usually that happens within a week or so be on the lookout for that, and our e-news will announce when that is available. But that's going to allow you to take a look at this recording again if there's anything that you missed, you wanted to see again. And also I would encourage you to share this recording or the link to this recording with anyone that you think might find this information useful or helpful. That brings me to our agenda for today. So today we are going to focus on provider enrollment and that process for federally qualified health centers. Now, as part of that, we will be talking about some basic eligibility and coverage for FQHCs. So we'll be talking a little bit about covered services. We will not be talking about claim submission, though I will be giving you some resources, and some resources are included in your presentation for today that'll provide more information on that billing piece for FQHCs. The focus is going to be on the enrollment process, and as part of that, we're not only going to talk about where the application is a little bit different, but the process itself is a little bit different, and there's some unique documentation that's required with the FQHC, so we'll talk about all of that today. As you're all aware, Medicare loves its acronyms. Today's session is no exception to that. So I have included in your material today an acronyms page. There was one update. I apologize, I did have a typo on the acronym for health professional shortage area that has been updated. It did say service instead of storage. I apologize for any confusion for that, but you do have all of that. The two that I'm going to be talking a lot about today are going to be the Health Resource and Services Administration, which is HRSA, and then a little bit about that health professional shortage area, which is HPSA. But again, you have these to make things a little bit easier for you today. So I'll start with an overview of FQHCs. So FQHCs are defined in the Program Integrity Manual, Publication 100-8, Chapter 10, and they are discussed and defined in Section 10.2.1.4. And I'm going to go out to that site real quick just to show you where that is. So from the CMS website, you're going to go into, and I typically go to the manuals and forms. It's always on the top. It's the quickest way to get to the Program Integrity Manual. So I go ahead and I grab that, and I'll go into the Internet-only manuals. From here, I'm going to go into that publication 100-8. And then Chapter 10, Provider Enrollment. Now this is a rather large manual. I typically search, and so I will search for that section. You will also see it here in the table of contents. Depending on how you're accessing this, your browser settings, this may reflect as a hyperlink and you can click on that section. Mine is not at the moment. So I'm going to go ahead and put that chapter in there. And by searching that chapter number, I'm going straight to the section of the Program Integrity Manual that talks about federally qualified health centers. So there's a couple of reasons I'm bringing you here. We're certainly going to talk about the qualifications here in just a minute and what we're looking for when we're doing that. But I wanted you to have this for reference. This goes into the statutory background, which we will not be including a ton of today, and it's going to give you some Code of Federal Regulations or CFR references that may be useful to you depending on your scenario. It's also going to talk about the requirements for FQHCs, including talking about lookalikes, but then it's also going to give you some insight on what provider enrollment is looking for when they are processing a federally qualified health center FQHC's application. It also includes the process that we're going to talk about today. So just a resource for you to have should you need that. So typically an FQHC is going to be providing services to an underserved population. Now, this doesn't necessarily mean rural. An underserved population could also be in an urban area. You're going to find them in health professional shortage areas. And some of the questions that we see on the enrollment side is, how do I know if I'm in one of those areas? So there's a link that Ellen's going to provide to you in just a few minutes, but I wanted to pull it up here. I want to show you where you can find that information. And so I am going to, give me one moment. Where I'm going to is the Health Resources and Service Administration website. We're going to use this a lot with FQHCs. Here I'm showing it for you. Thank you, Ellen, has put that in the chat. Here I am showing you where you can look to see if you're in an underserved or health professional shortage area. Later on, we're going to be talking about the HRSA grant or certificate that's required as part of enrollment, and you're going to be leveraging this website for a couple of things there as well. So just starting with looking for that healthcare professional, or excuse me, that health professional shortage area. To find that information on this website, you want to go into the data warehouse menu or the drop down, and there you're going to have a link to find shortage areas. Once you get in there, it's actually taking you to the HRSA database on that data.gov. You may already be familiar with this. Data.gov also houses information on our revalidation cycles. So it's in very much the same place. It's just a different database within that warehouse. So here it's going to first provide you with some instructions, and it's giving you a screenshot of what this database is going to look like. But you can go in and you can search for HRSA areas by state and county. And this is national, so this isn't just specific to J5 or J8. This is, again, a national list. And here it's going to allow you to either select state and territory, and it's going to allow you to select counties. You can also narrow down searches, because obviously with this being a national list, it's fairly lengthy. You can narrow it down by the discipline or the type of service that you're looking for classification as a HRSA area. So you do have a few filters that you can use here. I'm just going to pull up Iowa, and I'm going to pull up all counties. You do have to put information in both of these fields. And by hitting submit, as you can see here, it's going to tell you the discipline, so those types of services that they're classified. It's going to give you their HRSA ID. It's going to give you the name, which is typically the county. It's going to give you the designation, the state, and then some additional information, rural status. Remember, I mentioned that it could be rural or urban. It's going to have that information designated here. So this is a resource if you're working with FQHCs, or even if you're working with anything as far as HRSA. I would encourage you to leverage this resource for that information. All right. So along with serving underserved populations or being in a health professional shortage area, FQHCs are going to be offering, or they must offer, a sliding fee scale. They're going to be offering that sliding fee scale for individuals with an income that is below 200% of the federal poverty level. So that's one of the other things that is being looked at. Now, these qualifications, I do want to point out, are not being looked at by the MAC during the enrollment process. They are being looked at by HRSA when they are deciding whether or not to issue either a grantee certification or a look-alike certification. So that HRSA becomes a real integral part of the provider enrollment process, because those designations, that determination of they qualify as of an FQHC is being made at that level before that application comes in. Now, they are going to be providing outpatient clinic settings, and but they are also going to be enrolling on the CMS 855A. We will talk about that a little bit more in a few minutes, but I just want to point that out. Outpatient clinic settings, so outpatient services, but they're submitting an 855A. They're enrolling like a Part A facility, which is typically inpatient. FQHCs are a little bit different. They're going to bill Part A, meaning they're going to bill on the UB04 or the 837I transaction. However, their claims are going to be paid out of Part B funds. And that has to do again with their classifications. I do want to point out, if you've ever worked with a critical access hospital, FQHCs are a little bit different. Critical access hospitals will enroll their group membership in the Part B side for reimbursement. FQHCs will not. Everything is coming in on that facility bill, and you're not enrolling the providers within. They're not going to receive separate enrollment. They're not going to receive a separate, any type of separate provider number in order to bill, and they're not billing Part B separately. FQHCs, everything's coming in on that Part A facility bill. So let's talk a little bit about the services that are covered. So as I said, professional services, we're looking at an outpatient setting. They're going to be providing physician services. They can also be providing services that are completed by a non-physician practitioner. Those are also acceptable. We're also going to see that they are going to provide things like primary care, preventative care, mental health services, substance abuse services. Those are all things that fall under the FQHC's purview. We'll also see that they're providing outpatient diabetes self-management training, and that includes services provided by medical nutrition therapists, or MNTs, again for diabetes or renal disease. Now, as far as a more detailed look at what those services are, there is a link that's being included on this chat. I'm actually just going to go ahead and click on that. I'll show you how to find it the other way. This is a link on our website. That link takes you directly here. If you were to come straight to our website, what I would encourage you to do, I'm typically someone who will search on our website, and if you search by FQHC, if I would spell it correctly, FQHC on our website, you're going to come up with 5 really useful resources. There's one on enrollment, which we'll talk about in a little bit. The one that I'm looking at now is for claims. And because we're focusing on provider enrollment today, I still did not want to leave you without any resources with regards to claims and billing and some of the specifics about type of bill or the revenue codes that are used, services that are covered. And this particular resource, again, which is included in your material for today, does go into the claims processing. It goes into the billing. It talks about the billable providers, including their credentials, their specialties, so that you can verify whether or not the providers you're looking to bill this way are included as far as billable services. And then it does also list all of the billable services that an FQHC is eligible to bill for, all in one spot, so that you have that information, a little bit like an FAQ or a quick reference for you. It's also going to give you some links for the benefit policy manual that again goes into a little bit more detail on some of the items that are covered and how they would need to be billed. Okay. So eligible provider types, keep in mind again, we're not talking about the individual providers, we're talking about the facilities when I talk about eligible provider type. Because again, the FQHC is going to enroll on that CMS 855A application. They're going to enroll very much like an inpatient facility, but again, it is an outpatient facility. So some examples would include healthcare program grantees. So these are providers that have a HRSA certificate and are receiving funds through a HRSA grant. Some examples of that are going to be community health centers, migrant health centers, homeless health centers. And again, these are just examples. This is not a complete listing. A lot of this eligibility for a grant is determined on that HRSA website that we went into. You will also see healthcare programs that are considered lookalikes. They'll also be run through that HRSA grant program. However, a lookalike is not receiving grant funds. And typically what happens there is they're enrolling as an FQHC. They meet the requirements, but they're not receiving those funds, and they're typically falling into one of the exceptions that exists. And on the pre-submitted questions, we did have a few questions about lookalikes and resources for lookalikes. So I am going to show you where you can find that information. And that is going to be in the resource on our WPS GHA website that is for FQHC enrollment. And that is also a resource that's on the resource page of your material today. So if you go into that enrollment, there is a section here on lookalikes. From an enrollment perspective, we are looking for that HRSA grant. However, so that you have a little additional information of what HRSA is looking for when they're establishing a lookalike, there is a reference to CFR information that talks about lookalikes, and it is in section B, the exceptions. Again, typically this is all reviewed and determined by HRSA. So let's talk a little bit more about the HRSA grant. So what you're looking at here are examples of a grantee HRSA grant or certificate and a lookalike. So FQHCs that, again, if they are a grantee or a lookalike, they are going to get this certification. They're going to get it. The difference is going to be how it looks. So on the left, what you're looking at is a grantee, and this is an FQHC that is receiving a grant and receiving funds or receiving funds under contract for Section 330 of the Public Health Service Act. And it's going to indicate it's their notice of award. That's the other name for this. And you're going to see the red box, and it's super small, but that is the general location. What says there is it says grantee. So that tells us that this is an FQHC that is a grantee that is receiving funds. They are receiving grant funds to operate as an FQHC. It gives us their project dates, and those project dates are basically their effective and termination date of that grant. That is something that we will look at during the enrollment process. And we'll talk about this as we go through this, but those project dates, that HRSA grant needs to be in effect for the entire span of time that it takes to enroll an FQHC. FQHC's process is slightly longer, and it is because of an additional process that is required by CMS for them. The reason I bring this up is if for some reason that HRSA grant were to expire while an enrollment application is in process, doesn't mean you can't enroll as an FQHC. However, I would encourage you to take a look at that because you'll want to make sure that you're sending in the renewed HRSA grant as you get it, because if we have an expired HRSA, MACs are going to develop for that. We can't enroll an FQHC if the HRSA is not effective at the time of enrollment. So keep that in mind. That goes for lookalikes as well. And for lookalikes, which is what you're looking at on the right side of your screen, this is for a provider that is eligible to enroll as an FQHC. They have received the HRSA grant, which will tell the MACs that they are eligible to enroll as an FQHC. They meet the requirements, but they're not receiving grant money. They're still certified and they can enroll this way, but they're not receiving grant money. And that red box on that image is where it actually will say that they are a lookalike. They will say that they're a federally qualified health center lookalike, so that we know that. Now, from an enrollment perspective, we don't enroll them any differently. They still complete the CMS 855A. It's just that we have the documentation that we forward to CMS that just lets them know it's a lookalike. But from an enrollment perspective, they don't enroll any differently. Couple of things in general for both grantees and lookalikes. The address on the HRSA has to match the address reported on the CMS 855A. If it doesn't, MACs are going to develop for that. So it needs to match the address in Section 4 of the CMS 855A. We'll talk about that just a little bit more in a few minutes. And if there is an address change being reported, that is a scenario where if that address is being changed, that address change, that location change does need to be approved by HRSA, and they will be issued a new certificate because they're going to update that address. It's going to tell us that they approve of that change. So the HRSA certificate is really driving a lot of what we look for in provider enrollment. We need to make sure that HRSA has all of their ducks in a row before we as a MAC will enroll that FQHC. So that's going to be your first step. If you have an existing FQHC that's looking to make a practice location change, you need to contact HRSA and apply for that location change before you report it to the MAC. If it doesn't match, you are going to see an enrollment delay, and we simply can't proceed. Now, HRSAs are going to be required for all initial FQHC applications. They're going to be required for revalidations. FQHCs are subject to the revalidation process every 5 years, or in the event that CMS declares the need for an off-cycle revalidation, we will need a new copy of this grant. We'll also need it for change of information, as I just mentioned, and if there is a change of ownership, also known as a chow, so where there is a buyer that comes in and purchases an FQHC from the seller, we're going to be looking for that HRSA on that chow, what we call the chow buyer application. That's going to be the entity that is assuming the provider agreement, assuming the CMS control number, also known as a provider transaction access number. It's the same thing as their Medicare number, their PTAM. They're going to assume all of that, but we need to ensure that that HRSA grant has been transferred and all of that information is still active and accurate. So a lot rides on this. The one time you won't be asked to provide this is going to be for a reactivation, which is typically fairly rare for a FQHC, but it's something to be aware of. So before I get into the application itself and where that is different, I do want to spend some time talking about the enrollment process at a higher level. So I've mentioned a couple of times that the provider does submit a CMS 855A. Again, they're going to bill on that UB04, that 837I transaction, but they're going to be paid out of Part B funds. But because they're billing on a UB04, that 837I transaction, they're billing in our fiscal intermediary system. So they're billing in our FIS system. So they do need to submit an 855A. It's the only way to get them established. Their billing is that facility. From there, the MAC is going to review that application. They're going to be looking for that HRSA. They're going to be looking for the, there's a self-attestation statement that the provider submits. It's the Exhibit 177 that allows FQHCs to bypass a state survey because they can attest themselves of meeting qualifications. We're going to be looking for all of that information, and we're going to be developing for any missing information, any discrepancies, anything that's insufficient. Something to be aware of is if there is development, that application will not move on to the next step, which is referring it to the Provider Enrollment Operations Group. That's CMS. So we will do all of our screening, our review, our verification process, and our development, including getting all of that information in before we will move that on and recommend for approval to the Provider Enrollment Operations Group. And you'll notice that they're going to that POG versus a state agency. And that is because FQHCs are not required to have that state survey, again, because of the Exhibit 177 that allows them to self-attest to meeting the qualifications. And there are links to that. We'll get to that in a few minutes, but there are links to that form that is a CMS form. So we'll make sure that you have that. It just streamlines, that form streamlines that process, again, allowing FQHCs to avoid that survey process, which can take quite a bit of time. The idea is to make this easier and relieve that provider burden. So once PIOG does their review and they look at that, the PIOG will approve our recommendation as a MAC for approval. And I want to be clear that the PIOG CMS is actually the entity that is determining what that CCN or that P10 is going to be for the FQHC, and that's quite different than it is for, say, Part B providers. The MACs are fully involved and in charge of assigning those P10s. On the Part A side, and FQHCs are enrolling that way, CMS is assigning that. CMS is also accepting and activating the provider agreement. They're agreeing to that self-attestation, that 177, and as part of all of that, they are also telling the MACs what the effective date or certification date, the first date of service that can be billed for that provider. That is all handled by CMS. They'll provide that approval back to the MAC. They'll send us a notification. And from there, we can go into the provider enrollment chain and ownership system, which is where we will complete that enrollment process, which includes making sure that all provider information is entered appropriately and completely into that system, making sure that that P10 number has been issued with the correct effective date, and it includes the notification letters. So you will receive that. You will also, though, just for awareness, when we send our recommendation to CMS, our recommendation for approval, you will receive notification that that has happened. However, once it's in CMS's hands, they are in control of that, and it will remain in that recommend for approval state, particularly if you're submitting electronically through our PAYCO system, you'll see that recommend approval. That means that PIOG and CMS have it for review to take care of their part of that process. So before I get into the application process itself, meaning the application, the CMS 855A application, and what is needed for an FQHC, I just want to check in with Ellen. Do we have any questions in the chat?
We do have a question. This is from Emily, and it says, we have already enrolled with Medicare as an FQHC and are adding another site location. We have our notice of award from HRSA approving the new site. Do we need a HRSA deeming letter that has the new location address?
You will need a letter that has the new location address. That's something we were going to get to in section 4, but this is an excellent question, so I'm going to address it here. When we get to section 4 of the application, FQHCs when we enroll them, are only allowed to have one location. So each location is going to enroll independently. So you're enrolled, but this would actually require a new CMS 855A to be submitted. It's going to be built as a separate P10, and we would need that separate HRSA. Excellent question.
And that's all the questions we have so far.
All right, great, Ellen, thank you. So now let's look at the application process, that enrollment process for that application. So first, submitting the applications. You have a couple of options. Either way, you are submitting the CMS 855A application. You can submit that electronically through our provider enrollment chain and ownership system, also known as PACOS, or you can submit that utilizing a paper CMS 855A application. Now, if you've been on any of my webinars, you've heard this spiel before. I am always going to advocate for submitting electronically versus paper. Both are asking for the same information, but for instance, PACOS, which you can see I've included a link. PACOS here is an electronic system that is going to ask you a series of questions. If you've ever submitted your taxes online through some of those do-it-yourself tax software programs, it works very much like that. It asks you questions, and based on how you answer those, specifically in this case, selecting Federally Qualified Health Center, or FQHC, it's going to build the application to that provider type. It's also going to give you the list of required documents based on that provider type. So it's going to eliminate the pieces you don't need, but it's also going to make sure that you have all of the fields, and they call them topics, which is basically the equivalent to a section in the electronic world. It's going to make sure that you have all of these. Another advantage is this feeds directly into our side of the PACO system. So when we get this for review, there's some automations that we're able to take care of, specifically with data entry. We still have to do screening and verification, but it's simpler to do that through the electronic system because of those automations. A paper application is an electronic template, and it's a PDF form, so you can go in and you do key in all of the information. In fact, you have to. We cannot accept handwritten forms. But once you have that information completed, you will then have to download it or print it off. You're going to have to throw that in the mail. You're going to have to send that to us, either regular mail or certified or overnight in some way. That's going to need to be opened up. It's going to have to be scanned and ingested into our workload system. And then we're not going to be able to take advantage of some of those automations, again, specifically with data entry. So that's still a manual process, unfortunately. Processing time for a paper application, provided there's no development. Development could tack on potentially an additional 30 calendar days because that's the time allotted for providers to respond. But a paper application with no development needs to be processed within 30 days. Typically, we're a little bit ahead of that, but that fluctuates with inventory. But processes in 30 days from the max review. This does not include the PIOG review. A PACOS application, something submitted electronically, that processes within 15 days. And we're typically ahead of that as well. But again, that's because we can leverage some automations there. So I'm always going to encourage you to do that. If you've not looked at PACOS and you're interested, take a look at our WPS GHA YouTube site. There is an encore that we did earlier this year regarding PACOS basics, and it kind of walks through it does. It walks through high level how to sign up for PACOS, how to manage connections, and how to start a variety of application types. So that might be helpful to you. My other argument for PACOS is revalidations. With a revalidation, you go in, you review the information, you make changes if you need to, and submit. With a paper, you have to fill out the whole form again. With a paper, you cannot fax it and you cannot email it. It must be received through physical mail. The only electronic submission method is through PACOS. So once you've decided your method, you are going to need to complete the required sections. And as we go through this, I'm going to show you both the paper side and the electronic side so that you can see the comparison and know that we're asking for the same information. So on the PACO side, which is what you see on the left, you are going to see the application questionnaire. And when you're submitting for an FQHC, you're going to have to decide what you're doing. Typically what we see is creating an initial enrollment, revalidation. There are some instances where we'll make changes or if we're deactivating. So make sure you're selecting the proper one. If you're doing a revalidation, you absolutely have to have an enrollment that's already in PACOS. If previously you've always submitted on paper, you may need to submit it electronically as an initial, even though it's a revalidation. That is acceptable. When it comes into our side, we will see that that provider is up for revalidation, and we can adjust that piece on our end. We have ways around that to process it as a revalidation, and then you'll be connected, if you will. Then what happens when you make those selections, it's going to give you all of the appropriate topics, and initials and revals are the same. That's why we can make that shift. On the paper side, you're going to see section 1, basic information, and there's going to be 2 columns. The first column is the reason for submission. This is where you can select new enrollee, couple of various changes, revalidating, reactivating, terming, just like we talked about. The second column is going to tell you the sections of the paper application that must be submitted. So by checking that reason, you're still going to have it laid out for you which sections that you need. We're not going to leave you wondering what sections to complete. It's still there. Again, just a more manual process. When you get to type of provider, in PACOS, this is super important. This can't be changed. You want to make sure that you're selecting Federally Qualified Health Center, FQHC. If you select the incorrect one of the things that we do see is a rural health clinic. FQHCs cannot be enrolled as an rural health clinic at the same simultaneously, and so that is something that we look for in enrollment. Once in a while, we'll see where the selection gets made incorrectly here. That provider type in PACOS is not something that we can change. It typically involves deleting the application and having it resubmitted. So make sure that you're reviewing this list and making that proper selection. It's also part of what gets you that customized list of documents and those topics to fill out. On the right side, you're looking at the paper section 2A. Same thing here. You just want to make sure that you are selecting Federally Qualified Health Center, and it's going to be in section 2A1. 2A2 is for hospitals. Sometimes we'll see items filled out in 2A2 for FQHCs, and that is ignored. That's not something that applies here. We're always looking for it up in 2A1. From there, everything's pretty standard. You're filling out identifying information in section 2, so we're looking for things like the legal business name, tax ID, all of that. So I am jumping to section 4A. This is where things are a little bit different again for an FQHC. For an FQHC, typically we're asking that you list all locations that are owned and operated. However, as I stated before, you can only have the one. And that's where this is just a little bit different. If you have multiple locations, it is a separate 855A, a separate HRSA grant, and a separate enrollment. That is simply how CMS has designed the system and has designated, or their directive has indicated that we have to enroll them. You still have to list primary location. There's only one, so it will default. But you're also going to want to identify the type of location in section 4 so that we know the type of facility that we're looking at. Section 4 is that section 2 and that section 4 are really the two pieces that are different from an application completion standpoint. Again, we're asking for ownership information. We need to have the organizations with ownership and the members with ownership, contact information. That is all the same as any other Part A provider. Where FQHCs do vary, again, is with their documentation. And I've talked a lot about that HRSA, but that HRSA does need to be there. That is something that we do leverage. That HRSA website that we looked at earlier, we do leverage that to verify the grant. We'll verify the dates, okay? We're going to need copies of any licensure that the FQHC has, any accreditations that they have. Accreditations are optional, but if they're applicable, we want to see those. Again, those help speed that enrollment process along if they're provided. Certain things will have already been verified and we can leverage those verifications there. The tax ID verification, we are going to need that. It does need to be something from the Internal Revenue Service. It does need to be something that's printed out of their computer. It can't be handwritten, and it can't be from your accountant or attorney, things of that nature. Some examples will include a CP 575 or your confirmation of tax exempt status, your 501c3 status. We'll also see 147Cs. Those are typically duplicate notification letters that get issued, but we need to see the legal business name as it is attached to that federal tax ID. That all needs to match up in our system or we can't get the FQHC or any provider enrolled. If the FQHC is reporting any type of ownership in Section 5, so there's a parent company or there's a management company, we will also ask for an organizational flow chart, and it's just basically an organizational diagram showing the hierarchy of that organization. This is something that we do see missing quite often still. It was a flexibility during the COVID-19 pandemic. However, that is a flexibility that has been let to expire. It was not extended, and we will develop for that if we don't receive that. When an FQHC is setting up, when all providers are setting up for the first time, they are going to be paid electronically. So with an FQHC, we will be looking for a CMS 588 electronic funds transfer agreement. And there's a link here in case you need that. That electronic funds transfer agreement is going to ask for the account information, the account holder information, and it does need to be signed by an authorized or delegated official. And we are going to need account verification documents. So they need to show the routing number and the account. Verification documents include a voided check or a signed bank letter. That signed bank letter can be signed by anybody who is a representative of that bank. So from the teller to the president of the bank, it does not necessarily need to be from your particular branch. We understand people are using national financial institutions, so it may not have an address anywhere near your federally qualified health center, and that is acceptable. We are looking for those signed letters to be no older than 1 year, just making sure that we have current information. And on the voided check, one thing I want to mention, it cannot be a starter check. We don't have any limitations on the check number, but it cannot be a starter check where anything is handwritten in as far as account information. If the FQHC or any of its owners or managing control entities or individuals have any adverse legal actions to report, they do report those in Section 3. If they're answering yes to that and reporting those, we do need copies of documentation showing what the action was, who it was taken by, and if there was a resolution. Having an adverse legal action, I just want to be clear, does not necessarily preclude an entity or an individual from being enrolled or part of a Medicare enrollment. However, some of them do need us to seek CMS guidance before we can continue. So just because there is one doesn't mean this is going nowhere. It just means we need more information to make the best enrollment decision that we can. And then Exhibit 177, and I have included a link here for you to that form as I mentioned before. This is the self-attestation that the FQHC meets Medicare requirements. So let's take a look at that. So this is a copy of the form, and it is, and as I said, an attestation of why you qualify as an FQHC. So you'll check the box. There's a second page where it does need to be signed. It does have to have the legal name of the entity, the DVA, if there is one, and where they're located. This is again how FQHCs can avoid that state survey process, which can take a long time, again, reducing that provider burden. This Exhibit 177 is required for initials and changes. That's typically where there's address information that might be changing. It is not required for reactivations or revalidations. Just the HRSA impacts those revalidations, but not that Exhibit 177. Enrollment fee and site visit requirements for FQHCs. So FQHCs are considered they are in the limited risk category. So by default, they are not required to have a site visit, and that would be on the MAC side versus the state survey. They're not getting a state survey, they're also not getting a MAC site visit. The only reason there would be a MAC site visit involved is if we had trouble verifying the location that was listed, or we've been given CMS direction to do a site visit because they have further questions. So no site visit requirement. However, there is an enrollment fee requirement for initials, revalidations, and addition of practice locations. Now that last one's not typically going to happen with an FQHC. They're not going to increase the number of locations, and if they do, that's actually coming in as that initial enrollment. And that fee is $709 for 2024. Obviously, it's early in the year, so we haven't heard anything about 2025. And what you're looking at on the image that you're looking at, that is a matrix that is available on the CMS website that will go through the different provider types and when we require that fee. So that's just some documentation for you. Before checking with Ellen for some questions, here are some of those links that I've provided to you. First one is Chapter 10. I'm including two sections in there. One, the section that we went through that defines FQHCs and their qualifications, which is 10.2.1.4. But I'm also including the risk-based screening, which just outlines that FQHCs are limited screening risk, and that's that 10.6.15. Additionally, we talked about that Medicare Benefit Policy Manual that talks a little bit more about billing, Chapter 13. I'm including that. That bottom one is that matrix that I just showed you that shows the provider types and the matrix of when an enrollment fee is required. This would be beneficial for other provider types as well, so you'll have that. WPS resources, I did show you on our website. If you search by FQHC, there's definitely a few things here for you. I'm going to go back to that and show you what those are. We talked about the claims resource. Oh, my apologies. We talked about that claims resource that goes a little bit more into billing. There is an enrollment resource as well that talks about everything. It has links to the HRSA and information about that. There's also a FQHC resources page that has all sorts of links to manuals, law references that provides additional information for FQHCs. It also links up to our other resources. And then the final one that you have there is for payment. And this talks about the payment methodology for FQHCs. So with that, I'm going to check in with Ellen. Ellen, do we have any questions?
Yes, we do. Rebecca has sent a question in and it says, do you have a link to instructions on how to add and remove providers, physicians, physician assistants, nurse practitioners, etc., in PACOS under our FQHC?
Okay. So with that, if you are, I am presuming that those providers have been enrolled somehow on the Part B side. And in that case, you would be looking for deactivation instructions. And I'll go ahead and put this. That is, nope, we don't want that one. Pardon me. That is going, you're going to get those instructions through our decision tree. Those have been moved. let me grab in the wrong spot. Pardon me. Right here. I'm going to put this link in the chat. And that's a decision tree where it'll ask you a series of questions, much like PACOS, and it'll instruct you on the application that's needed. If you are removing a provider that has a PTAN, you're deactivating them. And to do that, you would need to fill out the 855I, but only certain portions of it. It would be sections 1, 2A, 4F, and then we need the signature in section 15, just letting us know which PTAN to deactivate. But by answering the questions in that decision tree, you'll get that same list. Any other questions, Ellen?
Leanne, I actually have a follow-up question on her question.
Yeah.
So I thought I heard you say earlier that when you're enrolling your FQHC, you're not attaching providers to that FQHC. Is that correct?
That's correct. They're not enrolling in the B side like they would with a critical access hospital.
Okay. So, so if I'm understanding you correctly, you enroll your FQHC and your physicians and practitioners practicing under your FQHC, they just practice there. And the FQHC bills?
They're billing for that service.
Okay.
And
If your practitioners also have a private practice where they're billing separate from your FQHC, they would stay enrolled for the other practice. Is that correct?
excellent question. Absolutely. So their affiliation with that FQHC is not going to impact any private practice they have or any other clinics that they work for. They would still enroll as a group member or in their private practice as they would outside of the FQHC. It's just when they're practicing for that FQHC, their setup is different. And under that claims area, it talks about that a little bit. So that's a good resource for that. It talks about the revenue codes that they would use.
Okay. We do have another question, and it says, do the AO/DO need to have a PACOS login to sign applications digitally?
Excellent question. So this is a question we do get quite a bit. And the term AO and DO, that authorized official in particular, is muddied just a little bit between the identity and access, which is that PACOS login, and the PACOS system where the enrollment actually happens. So the authorized delegated official that has access to PACOS, they are really the authorized official for approving connections. So if there's staff that are acting on the provider's behalf, they're granting access to others for their enrollment information. That's a different type of an AO. If they are having that kind of control over those connections, they have to have a PACOS login ID. An authorized official can be designated on the application, and they're not necessarily going to have a user ID and password. When you indicate an authorized official to sign an application, if you're doing it electronically versus upload, and upload is always an option, which is uploading a paper certificate to an application. If you do upload, you need a user ID and password. But the AO or DO does need to be on the application, indicating that they're an AO or DO, and on the 855A, they do that just by signing as the AO or the DO and designate themselves, but they also need to be reported in Section 6. If you are signing electronically, same thing, they still need to be designated on the application or existing on the enrollment record, but when you designate that they're going to sign electronically, there's an email that's going to go to that AO and DO, providing them with instructions and access information to append their signature electronically. they do not necessarily have a user ID and password for PAYGOs. The system recognizes that, and there's a way around that. And that's the difference, is whether or not they're set up to manage access to your enrollment information, or they are simply signing applications on your behalf.
Okay, that's the last question that we had so far.
All right. Before I wrap things up, I do want to make you aware of something we're pretty excited about. CMS is holding a National Provider Enrollment Conference this year, and they are holding it in person. They're working with Noridian to set that up, and they're hosting that in San Diego, California, and that's going to happen in August. It's going to be August 28th and August 29th. This is an in-person where they're going to be talking about really all things provider enrollment, both Part A, Part B, any upcoming regulation changes, any proposed changes, any system changes. Not seeing anything on the agenda about PAYCOS 2.0 just yet, because that's still in development, but August is a little ways away, so stay tuned. That agenda could change. There is a link here that takes you to the agenda and the plan, the schedule, and registration information for that conference. And here's the best part. This is being offered at no charge to the provider community. So this is your opportunity to go hear CMS, talk to CMS, and also there will be MAC representation from all of the jurisdictions that you'll be able to interact with, ask questions of, and it's just a really nice gathering, networking, just a great conference to attend. So I encourage you to take a look at that if you're interested. Again, no cost, it's a free conference, other than, of course, any travel that you may have. So this will end our presentation for today. I just want to do one more check-in. Ellen, do we have any questions in the chat?
No, ma'am.
All right, thank you. Well, on behalf of myself, Ellen, and everyone on the GHA Provider Enrollment Outreach Education team, I'd like to thank you very much for taking time out of your busy day to attend today. I'm looking forward to those survey comments. And again, please be sure that you're including topics that you'd like to see. Thank you again. I hope everyone has a great rest of their week. You may now disconnect.